Hello friends. Today let us discuss the drugs which are used for the treatment of the hypertension in the pregnancy. So there are four different kinds of the drugs which are commonly used: Labetolol, Nefidipine, Methyldopa and Hydralazine. And now we will discuss each of these drugs one by one. So let us start with the Labetolol. So Labetolol, it is the first line of the drug used for the treatment of hypertension in pregnancy. It is combined alpha and beta blocker. So by inhibiting the beta blocker, so it inhibits beta receptors in the heart and lungs, and it causes decreases heart rate and causes bronchoconstriction. And by inhibiting the alpha receptors, it causes vasodilation. So both of these actions ultimately lead to decrease in the blood pressures. Labetolol is contraindicated in the patients with the asthma. It is available in the 100 milligram tablet, and it is started with the 200 milligram BID. And maximum dose of the Labetolol is 2400 milligram per day, that is 600 milligram Q6 hourly. It can be given 4 times a day for the control of the blood pressure, and that is the maximum dose of the Labetolol. It is also available in the injection form, and 1 ampule of the Labetolol is available in 10 ml, and that contains 50 milligram of the Labetolol. That is 1 ml is equal to 5 mg of the Labetolol. So when a patient with hypertension comes in emergency, you give injectable form of the Labetolol to control the blood pressures. First loading dose is given, and then if the blood pressure is not controlled, infusion is started. How the loading dose is given? So loading dose is given stat 4 ml 4 cc of Labetolol, that is 20 mg of the Labetolol is given stat, and blood pressure is monitored. If the blood pressure is raised after 20 minutes, you can give 40 mg of the Labetolol, and then 80 mg after 20 minutes, and then repeat after 20 minutes 80 mg again till the maximum dose of the 220 milligram is reached. When the dose of the 220 milligram is reached and blood pressure is still not in control, you start infusion. How the infusion of the Labetolol is made? So for making infusion, you take 4 ampules of the Labetolol. As we have learned, the 1 ampule is available in 10 ml of the 1 ampule contains 10 ml of the Labetolol, and that is equal to the 50 milligram each. And you add 60 ml of the normal saline. So 60 and 40 becomes 100 ml. 1 ampule contains 50 mg and 4 ampules contain 200 milligram of the Labetolol, and 1 ml becomes equal to the 20 mg. So infusion is started at the rate of the 20 microdrops per minute, that is 20 ml per hour, and that 20 ml is equal to 40 mg per hour. You can increase the infusion according to the blood pressures, or you can decrease it according to the blood pressure of the patient. Onset of the action, if given in the injectable form, is less than 5 minutes, and if it is given in the oral form, onset of the action is in 2 to 4 hours. This was about the Labetolol. Let's move to the Nefidipine. Nefidipine is used for the control of the blood pressure. It is a calcium channel blocker. It has a rapid onset of the action, and mechanism of action, how it works: it inhibits calcium channels in the smooth muscles in the vessels, and which leads to the vasodilation and decrease in the blood pressure. Nefidipine is available in 2 forms, that is Adalat LA and Adalat Retard, and the dose is 10 to 20 milligram per day BID. Maximum dose of the Nefidipine is 120 milligram per day. You can give up to 60 mg BD of the Nefidipine for the control of the blood pressure, and onset of action is 20 minutes to the 8 hours. Side effects of the Nefidipine are headache, hypotension, tachycardia, ankle edema, and facial flushing. Nefidipine is not available in the injectable form. It is only available in the oral tablet form. Now Methyldopa. It is the most commonly used drug for the control of the blood pressure practiced in our country. It has the best safety profile for both mother and the fetus. Mechanism of action is most commonly asked in vivas and interviews, and you should be able to understand the mechanism of action of this drug. It is a centrally acting drug. It is an alpha agonist and it inhibits sympathetic outflow. Now let us understand the mechanism of action. Methyldopa, it is a prodrug. It is inactive form. Whenever it is ingested, it is converted into its active form, that is alpha methyl norepinephrine. Alpha methyl norepinephrine, it acts at the presynaptic alpha 2 receptors. It is an agonist at the presynaptic alpha 2 receptors, and by binding these receptors, it inhibits the adrenergic neuronal outflow through the peripheral nervous system. It decreases sympathetic outflow, which leads to the dilatation of the blood vessels and hence decrease of the blood pressure. So this some methyldopa is inactive form. It is converted to its active form, which is agonist at the alpha 2 receptors. By binding to the receptors, it causes inhibition of the adrenergic outflow and dilatation of the blood vessels and decreases blood pressure. Onset of action is 4 to 5 hours and duration of action is 4 to 8 hours. That's why this drug is prescribed 4 times a day, and it is available in the 250 milligram tablets, which are prescribed as 250 milligram Q6 hourly, and maximum dose is 3 grams per day. This question is again asked in interviews. What is the maximum dose of the methyldopa? And that is 3 grams per day. And what are the side effects? Side effects are headache, dizziness, tiredness, weakness, postural hypertension, loss of energy, depression, and liver dysfunction, all related to the decreased sympathetic outflow. And in the last, let us learn about the hydralazine. Hydralazine, it is an arteriolar vasodilator. It is an arteriolar vasodilator. It inhibits alpha receptors in the smooth muscles, which leads to the vasodilation and decrease in the blood pressure. Dose, it is available in the oral as well as IV form both. In the oral form, it is available in the 25 milligram tablet, and it is prescribed as 25 milligram 3 times a day, and maximum dose is 75 milligram Q8 hourly, and that is 300 milligram per day. Maximum dose of hydralazine is 300 milligram per day. It is also available in the IV form. Injection of the hydralazine is available in the 1 cc, and that contains 20 milligram of the hydralazine. Suppose a patient comes to you with raised blood pressure in emergency, and that is asthmatic, and labetolol is contraindicated, so you will go with the hydralazine for the control of the blood pressure. And how loading dose is given? 1 ampule is equal to 1 ml, and that 1 ml contains 20 milligram of the hydralazine. So you add 3 ml of the distilled water to it, which becomes 4 ml. Now 4 ml is equal to 20 milligram of the hydralazine. 1 ml is equal to 5 milligram of the hydralazine. So 5 mg hydralazine is given 20 minutes apart for the control of the blood pressure till the maximum dose of 15 mg is achieved. When you have given the maximum dose of 15 mg for the control of the blood pressure and blood pressure is still raised, then you go with the infusion of the hydralazine. And how infusion is made? 2.5 mg, that is 50 milligram of the hydralazine is taken, and 47.5 ml of the normal saline is added to it, which becomes 50 ml. 50 ml is equal to 50 mg, 1 ml is equal to 5 mg, and the infusion is started at the rate of 5 microdrops per minute, which is equal to 5 ml per hour. And the rate is increased or decreased according to the blood pressure. You can increase 1 ml every 15 minutes up to the maximum of 10 ml per hour. Onset of action is 5 to 10 minutes, and this is the last choice of the drug for the control of the blood pressures. And this was about the drugs which are used for the control of the blood pressure in pregnancy. Hope you are able to understand and able to manage a patient with hypertension in pregnancy. And you will be able to learn these drugs. Thank you so much.